Thank you, Gail, and thank you for the invitation to come back. This is actually the third time we've presented at an LHAC Forum, and it's really exciting to actually be a part of the communities across the LHD in terms of talking to the local health advisory committees. So as was illustrated before, we know that the people living in the communities know the best outcomes for their own communities, and we work really, really closely with a lot of people in the local areas to make sure that what we're actually bringing to them in terms of mental health education is what they need. So it's very timely that the previous speakers were actually talking about something that we're going to now build on in terms of mental health education. So just a little bit about the Rural University Mental Health Program for those of you who haven't seen us or heard us speak before. We actually work for Murrumbidgee Local Health District in this program called Rural University Mental Health. Previously it was known as the Drought Mental Health Assistance Program, but it had a name change when the drought technically ended, although we are still recovering from the long-term drought that we had. So now we work with rural communities and educate people around mental health issues, mostly in a prevention, promotion and early intervention role. And the nice thing about that is that we know that if we are educating communities before problems happen, we are less likely to see people ending up with long-term mental health problems. So how we do that is we work with communities and draw on the inherent strengths of those communities in order to tackle the mental health issues that they are experiencing and help prevent them from either becoming long-term or actually increasing in small community. We do that by fostering local problem solving, building ownership, which is really important in small communities, developing resilience in that community and maximising the use of what's already working well in the community. So we're not actually coming in to do something to a community, we're coming in to work with the community. And I think that's a really important part of what our program actually offers, because there's a lot of times where adversity happens in a community and lots of services come in and then they go. What we're hoping to do is work with community so that we can actually build on the strengths that are already there, because we know that rural communities are very, very strong, and we know that there are always ways that we can help them improve. And if we can leave something after we have moved on, the one thing that we do leave behind is our contact details, so that if you need us again, we can come back. And we have done that in communities across the LHD over the last few years. So how we do this is working predominantly with local service networks, and also health services and other community groups to identify what the community actually needs, because we need to know that what we're actually about to deliver is actually going to be relevant to that community. We help to plan and deliver those activities in partnership with those services or those community groups or whoever that it might be that we're partnering with to promote mental health. So to talk about how we need to stay mentally healthy and what we need to do to stay mentally healthy, especially in times where we are experiencing adversity in our smaller communities. We're hoping to reduce the stigma around mental health, and I think we are starting to break down some of those barriers, but there's still a lot of people out there that are really worried about identifying or admitting that they might be struggling with their mental health. We also hope to increase mental health literacy. So by providing more information about what mental health is, what mental illness is, what the difference between those things are, how you can access services, what we can actually do to empower ourselves to improve our own mental health, we can actually help reduce the incidence of long-term mental health problems. The other thing that we're trying to do is raise awareness of services and how to access them, and we know that that's a really important part of the process in our smaller communities where the services might not be on the ground in that town and people might have to travel. And sometimes it's really complicated and people get really confused about where they should go and what they should do. And the difficulty that they have if they've rung a service and found out that it's the wrong door. We try to help them find the right door to the service that they need. We also try to help communities adapt to rapid change and build resilience, and that's particularly in the case of when people might have suffered some sort of adversity. Our program has a role in helping in recovery from adversity, so fire, flood, all those natural disaster type things. But we also work in communities that have been have experienced economic downturn or another adverse event that's impacting the mental health of that community. By doing all of these things, we hope that we will reduce the incidence of mental health issues and alcohol and other drug dependency issues in communities by making sure that people have appropriate information about what to look out for, how to help people if they need help or if there's, deteriorating mental health in a person. The other thing that we're doing is, and this has been a bit of a model change for us in the last 12 months, is we're linking a little bit more closely with communities to identify people who are actually at risk of developing mental health problems, to try and provide education for those people, but also make sure that they understand where the pathways are to the care that they actually need and the appropriate care that they need. So whether that's our public mental health service and our mental health teams in the Murrumbidgee Local Health District, or it might be another service that's provided by a non-government organisation. We have a lot of information about all of those things so that we can help people get to where they need to be. And the other thing that we do is we work with our mental health services from time to time on projects and pathways to care, and we also help them plan for the impact of rural adversity, and also we provide some assistance for the mental health teams if they need it, if there has been an adverse event. It's a great job, we love it, it's very diverse, there's never 2 days that are the same. So at the moment we have a statewide workforce, it is a statewide program, and we have workers, rural mental health coordinators in every LHD, except, as you'll see, the Metropolitan and the Illawarra LHDs. And that's because the focus for this program is on rural adversity. So what's working, what's not working, and what is working for rural communities. Okay. So, why mental health education? We've always worked from a promotion, prevention and early intervention framework. And what's not been well represented in lots of documentation in the past has been how important that is to prevent people from becoming unwell. I'm really excited to see that in the new National Roadmap for National Mental Health Reform that's just been released, this is the quote that's come out of it. And basically it's saying, a society that values and promotes the importance of good mental health and well-being maximises opportunities to prevent and reduce the impact of mental health issues and mental illness, and supports people with mental health issues and mental illness, their families and carers to live full and rewarding lives. It's the first time I've actually seen a statement that's that clear about the direction that we need to take. In some pockets of our mental health services, we are doing that very well. In some, we need to improve, but at least now we have a national statement that this is the aim that we're looking for. So if we take out the sentence, a society that prevents and reduces the impact of mental health issues and mental illness in society, that's actually a society that has people who are well informed about mental health, who are able to attend to their own mental health and well-being, who know where to find high-quality information and assistance, who are able and encouraged to access appropriate services and support when they need it, early in life, early in the course of an illness, and early in any episode of a mental health problem. And also there's an emphasis on suicide prevention with a focus on increasing community awareness of suicide and help for people at risk of suicide. So the mental health education packages that we actually provide, which I'll talk about in a little while, encompass a lot of that. And so it's really refreshing for us to see now in a national document that the work that we know that we've been doing that has been working in small communities for a long period of time is actually being backed now on a national level. Okay, so the types of education that we have been doing, and some of you will have met us in that role, is the face-to-face type delivery, and this is just a really short snapshot of the types of things that we do actually have available in our little kit. But mental health first aid has been one of the ones that we have been doing over the time that the program's been going. It's a 2-day program. Lots of people in this area I know have had it, have been to it and find it really, really empowering. The 2 that RAMHP have developed, which is the ones that we have been doing recently with the LHAC communities, the workplace support skills training and the community support skills training, which are a 3-hour and a 90-minute package, just highlighting how people can help somebody that might not be travelling very well. We also do topics that people specifically request. So if we get a request from a community, a sporting group, a community group, a church group, even a school, we have the ability to actually adapt a presentation to actually fit the needs of those organisations or communities, and read the play, which Merilyn's going to talk about a little bit down the track, because that's something that we've been piloting over the last 2 years in a select group of communities in the LHD. The other kinds of things that we do provide education at are field days. So we set up a stand and we talk to people about their issues and what's going on for them. We provide written information. We also provide contacts for them where we can on those issues. The Dramatic Minds Festival, which has been quite popular with young people across the LHD. We have festivals now in Temora, Wagga, Albury, Griffith and Tumut are looking at one for 2016. So we've been helping with those in conjunction with the youth mental health teams across the LHD. The Youth Mental Health Forums, which have been run in Wagga, in Albury and in Leeton/Griffith, also in conjunction with the youth mental health teams, and several other community partners, have been an opportunity for young people to come together and tell us what they need in terms of their mental health learning. It's been very exciting. And that forum has also provided an opportunity for young people to go back and start looking at mental health needs in their school, and they go back with a take-home activity to do. Well, Mental Health Wellbeing Expo, so anywhere where community gets together and is talking about health or wellbeing or anything like that, we can be a part of those things as well. And all sorts of other types of forums like this forum, other sorts of community events. It's quite interesting where we turn up sometimes. Last week was at the Rural Women's Forum up in Tumut. So it was more around farming and it was more around women's needs and the needs of farming communities, but there was a role for us to be there. The other thing that we do talk about in terms of mental health education for rural and remote communities who might not have access immediately to face-to-face services is the importance of using helplines and online services that are reputable. On your table you'll have one of these publications. It's a partnership between the Rural Adversity Mental Health Program and the Land newspaper, and it comes out annually, usually in October for Mental Health Month. The back 2 pages have some really lovely evidence-based telephone services and online services, the snapshot of which is up there. Sorry, I'm playing with that accidentally. And of course we have our access line, which is a really important link for our mental health community, our community into our mental health services. Most of those that are up on the screen actually have a online and a telephone presence, which is really important because there are many ways into a mental health service, and for some people face-to-face is not the way to go initially. Some people don't have access to face-to-face, and so if they can access some appropriate education, which is why this has been put together the way it has in this publication, because they are all Australian sites as well, so you'll get accurate, up-to-date information. Gives people a place to start. And the New South Wales Living Well plan that came out from the New South Wales Mental Health Commission late last year also acknowledges that it's a really important place for people who want some anonymity, perhaps to start with an online service or a telephone service. And they're really valuable for a lot of people who can access them and who feel comfortable. And in particular, we know that young people sometimes like a bit more of an anonymous start to a mental health service. Sometimes it's a little bit easier. So the 2 that I've got up there are the Kids Helpline, which have been around for about, it's more than 25 years, I've forgotten the number now, but they have a telephone counselling service and an online counselling service, which I've actually done a telephone counselling session because they were happy to help me learn about their service in that way. And it was a really informative process, and I think something that young people would engage with really well. Headspace also invite you to have a similar experience where there isn't a Headspace centre. I guess in some respects for Headspace we're a bit fortunate in the Murrumbidgee LHD because we have access to Headspace in Wagga. We also, our clients from Murrumbidgee still have access to the Albury-Wodonga Headspace that's just opened up, and there will be a Headspace in Griffith as well. So we have some extra opportunities for our young people who may want to access Headspace or alternatively may want to come to CAM services, the Child and Adolescent Mental Health Services through Public Mental Health. There's lots of new opportunities for young people now, which is really exciting. Okay. I'm going to hand over to Merilyn now because she's going to talk about how we work in partnership.
No, we didn't collaborate with Gail, even though we're both from Narrandera, about the next part of this presentation, because you will see that, we've connected very, very well with what people have spoken about previously. So the whole idea of working in partnership is basically to collaborate with people in local communities. Helen and I cover the Murrumbidgee Local Health District between us. It's a big area. And we don't know every rural community, the things that are going on in the communities. It's really, really different. And the people who know are the people who live and work there. So what we do is we work in partnership with all sorts of organisations within those communities to find out what's going on and what we can do and what we can provide to assist them. So local people are the experts. Country New South Wales is not one entity. Okay, it is endlessly rich collection of unique communities. The people who live in a town or region, including those who experience mental illness, professionals and the wider community understand the mental health needs of their town or region better than anybody. Okay, community funded and private service providers, including those in the fields of health, community services, education, employment, housing, justice and corrections, need to work effectively with each other and with individuals, families and carers to help people with mental illness to recover and maximise their well-being. Where possible, they also need to work towards preventing and reducing the risks associated with the development of exacerbating of mental health issues. So that's actually from the Roadmap for National Mental Health Reform. And there's some great photos up there. We do work hard, but along the way we do some really, really interesting things and meet some fantastic people. And the thing with partnerships is that some partnerships are really, really easy. Some can be a little bit more challenging and are a bit, and it is a little bit more difficult to get people together and actually collaborate with them and get everyone to cooperate to the end result that you want. But we're very skilled, and that's something that we have we've been able to achieve. So that's actually some of the stuff that we've done. Helen is very multi-skilled, which is fantastic. She's actually a trained baby masseur. So when we did an event over at Leeton for postnatal depression week, she was actually able to come along over to Leeton and do the baby massage at Leeton Community Health Centre. I was delivering training in Wagga to the centre care staff, and that's actually a photo from the Read the Play program, which has been a really great partnership that we've been able to work with sporting bodies, and I'll talk about that more later. Okay, so some of the organisations that we actually partner with, of course, the LHACs, which has been spoken about. So, Helen's been able to work with the Adelong Batlow LHAC, Gundagai and Henty. So she's done training and also linked in with some of the community events that the LHAC have organised in Henty, which has been really, really beneficial. I've recently been up in Young working with the LHAC and the Lions Club to present training there. I'll be in Leeton doing some training next week, and we've also done some stuff with Lorraine in Lockhart, but that was all about the support skills training that we presented on last year at the LHAC Forum. So, just from actually coming here and talking to you about the stuff that we've got available, some of the people on the LHACs have approached us, and we've been able to follow through with that, which has been really, really good. So yes, and we also use our connections and with our work colleagues within the Murrumbidgee Local Health Service. So all the different departments across the district, whether they be mental health focused or not. Sometimes somebody may have something organised, and it's nice to link in and actually talk about mental health when they've got some sort of health promotion activity going on, to actually bring that knowledge to communities out there. Community groups, so I do a lot of work in Wagga with a small community group called Riverina Bluebell, who are a group of volunteers that do some amazing work. So it's really nice to link in with them. And they don't have a lot of mental health background or knowledge, so it's good to be able to support them and talk to them about the sort of things that when they're talking that is appropriate, and maybe we need to think about that or talk to somebody else and link to them into some other professional support. Schools, of course, schools are a great captured audience, I suppose is one way of terminology that we could use. The children are there. We can actually work with the schools and provide all sorts of information to them. The Dramatic Minds Festival is a school-based program that we've been able to implement and has been really, really well received. But we also have done different education sessions at the schools. We've been invited in to actually go and present a short education session to numerous schools. I know Helen's done some down this way, and I've been out to Hay during Are You OK Day, and we basically presented information to the whole school in partnership with the Black Dog Institute. The Lions and Rotary Clubs, great service clubs in all communities, and they're really wonderful to partner with because they do know their local communities, and they have a really strong base of being able to engage people. Church groups, government and non-government service providers. So there are a lot of non-government organisations out there that have funding. A lot of different people have mental health funding. So it's really nice to link in with them and know the services that are provided, because we do know that with changes in government and changes in funding, different organisations get funding for different things. So it's really important that Helen and I link in with those local people so we're really well informed about what services are available and what can actually be provided in each town, because it does vary across the health district. We know a lot about Access Line and how to access the public mental health systems provided by the health district, but a lot of the other agencies, yeah, it does change from town to town. Community members, so somebody might be really concerned about something that's going on, and they can just contact us directly, and then we can work with them to actually form a working party and meet with some people so we can actually do something that addresses the community needs. And local government. Local government a really great support, and that photo was actually taken at Griffith when we did some youth-based work with the Youth Mental Health Forum and the Dramatic Minds Festival over there. So we basically formed a consortium and identified whether it was what was needed in the community. Okay, so why working in partnership works? So it builds the capacity across sectors of the community to support mental health and wellbeing through education, which is the link to what Helen was saying earlier. Develops a shared understanding of positive mental health. And, you know, when we do our education, a lot of the discussion that we have is around what is the difference between mental health and mental illness. And people still associate mental illness as the main thing when they think about mental health. You know, actually breaking down that stigma and getting people to celebrate the fact that they are mentally healthy is one of the things that we do a lot of, and we get some really positive feedback from that. Normalising the topic of mental health across all sectors. So again, through education, through all sorts of programs that we do. makes education strategies more effective and relevant to the community. So that's tailoring stuff. So that we know, and we know, and there was a discussion from Gail and also from Helen earlier, you know, it's all right for stuff to come out from Sydney about this is the way that we should do it, but rural communities are different. So we need to tailor stuff so that the audience know, we can actually target stuff so that the audience know what we're talking about. Break down the silos and improve relationships between sectors of the community. And there is silos, even in small communities. There are silos within organisations, within the mental health sector. So it's about working together, trying to get people to collaborate, because basically what we want to do is support the community. Okay, so the more effective use of resources and expertise, which equals richer outcomes. So we need to let people know about what's available, you know, the online resources, the telephone resources, all the sorts of stuff that people can actually access, even though we know that that services aren't available, face-to-face services are not available 24/7. There are other really good resources and services that people can link into from rural communities. Results in capacity building collaboration between sectors can enrich the partnership. And people know once you start to work in partnership with other organisations, with other members of the community, they know that they can actually contact you. You know, you might move away from what you've done, but it could be in 9 months' time that they will give you a call and say, is there any chance that you can come back and do something with us? Or someone's talking about doing something within the community. Can you come in and actually do some mental health education around that? So partnerships are really, really important. Okay, and a single partnership can be a springboard for other partnerships to develop. Okay, so it's even like the people from LHAC actually talking to members from the LHAC saying, well, why don't you contact Merilyn? So yeah, it can all expand and we can build on that. Okay, so this organisational chart, which is looking very pretty, thanks to Helen. I'm not going to take any credit for this because I got quite frustrated putting it together. This is just an organisational chart that basically shows you how we implemented Read the Play. So Read the Play is a mental health education program that is a little bit different because it's actually run with the AFL and netball clubs in the under 15 and under 16 age group. So we actually link in with the clubs. We go to the clubs after their training night or after the game, whichever suits, where we try and be really, really flexible to engage the club and the coaches and be there when it's suitable. And we actually go in and we deliver a 1.5 hour mental health education program. But it's actually a little bit different. It's not like a school lecture. It's run similar to what I would call is a trivia night. So there's a lot of activities, the tables competed out against each other, there is a prize at the end of the night, and it's fun. Very tiring for us because we're jumping around everywhere, but it is really, really fun, and we've had some great feedback from it and from the kids that participated last year. So we're actually doing a 2-year pilot of this program, which was actually developed in Geelong. So it's been a lot of negotiation and a lot of collaboration and liaison between multiple parties to get to the point where we're actually in the 2nd year of the pilot. So the program is actually called Read the Play, and Kempi Read the Play is actually an incorporated body that is in Geelong. So and they actually developed the program. Well, the original program was implemented in 2006, but they have modified it because part of the evaluation was that the original program that they actually developed wasn't very engaging, so they modified it to the format that it's in now. So they're the overarching body. So we actually engaged Read the Play Incorporated and talked to them about actually bringing the program to rural New South Wales. So that was one part of a partnership. That's the overarching bit. And then, of course, Read the Play Incorporated has partnerships with all the different programs that are actually being run. So you will notice that most of those are actually in Victoria, and AFL is very, very strong in Victoria. So Read the Play Murrumbidgee is the New South Wales pilot. Okay, so we've come in at that next level of the partnership. And of course, to actually get to what we had to do is engage other partners to make sure that we could roll the program out. Riverina Bluebell came on board because we had to purchase a kit, and so there was funds needed. So they have been really, really supportive in providing us with funds to buy the kit, and also funds for prizes and catering as we roll out our pilot. RAMHP, the program that we are employed in another partnership with the local health district, they also provided some funding support. AFL New South Wales, we actually approached them, wrote them a brief in regard to the program, asked them if they would be interested in it, and support us to actually roll it out, and they were. And then they actually identified the clubs that they would like to be part of the pilot. So that was another big partnership that has been really, really effective, because the clubs are more likely to engage when they know that the governing body is supporting the program. And of course, Murrumbidgee Local Health District, because Helen and I are actually employed by them. So that's been the other level of partnership. And then of course then we go from AFL New South Wales down to the 4 clubs that are involved in the pilot, which are Temora, the Northern Jets, which is actually Ardleaf and Area Park, so that's a combination team out my way. Ganmain, Grongrong, Matong, and notice I don't say Ganmain, it's Ganmain, Grongrong, Matong, Lake Jellicoe and Coolaman. So basically, yeah, basically it's around the area where I live. So yes, I do live in Narrandera, and the clubs that were identified to be part of the pilot were out that way. So again, partnerships with the clubs, with the senior clubs, with the junior presidents, with the secretaries, everything else, to actually finally get the 1.5 hour program implemented in the club. So to actually just have that one education program, there is a lot of collaboration right down that whole partnership organisational chart just for that 1.5 hour education program, but it's really, really beneficial. It has been, the results have been amazing, and Helen and I are actually going to present at the New South Wales Kids and Families Showcase in next month in regard to Read the Play. And again, because they find that a lot of the stuff that's actually presented at a lot of these forums and symposiums is based around the metropolitan areas. So they're really, really keen to have something from rural New South Wales. Okay, that's the end. Are there our contact details? And our contact details are also in the back of in the glove box guide. They were. I don't know if they are this year. They're our contact details. So write them down if you'd like to contact us. But we will be here. Yeah, and we're happy to have a chat to you. I've got cards too. So does any... Oh, wow. Yeah. Coming up. It didn't go.